Hello everyone, welcome back to another recall session. Today we're going to discuss about anatomy recall questions of AIIMS 2019, which is conducted two times in May as well as in November. So let us start discussing the questions. The first question is, the region marked corresponds to the surface marking for which of the following structures? So guys, this is the region marked. So this is corresponds to the surface marking of right atrium. So the answer is right atrium. The second question is, the action of the muscle attached to the marked area. This is the marked area. This marked area is greater trochanter, and which provides the attachment to the gluteus medius and gluteus minimus. What is the function of gluteus medius and gluteus minimus? It causes abduction of the thigh and their anterior fibers rotate the thigh medially. So the answer is abduction. Which of the following finger has two dorsal introsci muscle? So if you remember the anatomy of hand, middle finger has attachment of two dorsal introsci muscles. So the answer is C, middle finger. The structure that divides the liver into coinuads classification system is, so direct and straightforward question. The answer is A, portal vein, which divides the liver into the conoid classification system into the right and left hemiliver. Which of the following muscle is not supplied by structure marked as A? First of all, this type of gross anatomy figures, we have to first see the labeling. This is actually the knowledge that we actually gain from our dissection hall. So we have to master the gross anatomical figures that is present in all regions and that frequently asked. That's why there is a role of previous year questions, because we can easily conclude that what kind of figure They mostly ask, and which region we have to more focus on. So let us first label this figure. So this is the labeling of the figure. These both are optic nerves. This is oculomotor nerve. This is pons. This is cerebellum. These both are tentorium cerebelli, and this one is fox cerebri. So there are exactly two nerves that are marked here: optic nerve and oculomotor nerve. So origin of cranial nerves at the base of the brain is olfactory nerve, optic nerve, oculomotor nerve, trochlear nerve. The first one is trigeminal nerve, then abducens nerve. Seventh one is facial nerve, vestibulocochlear nerve, glossopharyngeal nerve. Then the 10th one is vagus nerve, accessory nerve, and hypoglossal nerve. So these all are the cranial nerves which are located in the base of brain and which are originated from different locations in the base of brain. So these two figure we have to know and we have to identify it very effectively, and then we can come to the answer very easily, and that becomes a cakewalk. So this is a figure of base of brain which arrow marked is suggestive of the location of oculomotor nerve, and the muscle that is not supplied by oculomotor nerve, that is superior oblique, because we remember the mnemonic that SO4 and LR6. So superior oblique supplies by trochlear nerve, and lateral rectus, which is the extraocular muscle, supplied by abducens nerve. The next question is the wrong statement regarding the levator ani muscle is. The first option is it supports the pelvic viscera. This one is true. The levator ani converge downwards and medially. This one is true. It consists of iliococcygeus and pubococcygeus. Completely true statement. It is attached to pelvic brim. First of all, let us discuss about the origin and insertion of levator ani muscle. The origin of levator ani muscle comes from three parts. The first one is body of pubis. The second part is arcus tendinous of levator ani, which is the thickened part of obturator fascia. And the third part is ischial spine. The insertion of levator ani is coccyx and anococcygeal. Refe. So levator arena is attached to the pelvic brim. This one is completely wrong statement, and this is the answer because levator arena is attached to the coccyx and anococcygeal raphe. Now move on to the next question. In the given section of heart, match the marked A, B, C, and D structures. This is the section of heart. We have to match these all structures. So let us label these all four structures. The A is membranous part of interventricular septum. The B is anterior papillary muscle of right ventricle. The label part C is anterior papillary muscle of left ventricle, and the part D is musculi pectinate. So the answer is C. Now move on to the next question. A lesion of the structure marked in the image below causes. See, we have to first of all master these all gross images. So let us first discuss about the labeling of this cut section at the base of brain, which is situated in the region of basal ganglia. So let us see the labeling of these structures. This one is pons. These both are pyramids. This one is olive, and this one is optic chiasma. So a lesion of the structure marked in the image below, that is actually the pyramid, and the lesion to the pyramid actually causes contralateral hemiplegia. Now move on to the next question. Identify the structure marked in the image below. Let us label this gross figure. This one is ulnar artery. This is ulnar artery. This is abductor pollicis brevis. This one is flexor pollicis brevis. This structure is radial artery. These three are common palmar digital arteries. So this labeled structure is ulnar artery. Ulnar artery, abductor pollicis brevis muscle, common palmar digital arteries, and flexor pollicis brevis muscle. This is the labeling of this gross image. Now move on to the next question. True regarding the lesion of the structure marked by arrow. This one is a gross anatomical figure of cubital fossa, and let us see this gross anatomical figure labeling. So we have remembered one mnemonic from our first year of MBBS, that is MBBR, from medial to lateral structures, that is present in the cubital fossa, that is median vein. The second one is basilic vein. Then third one is the tendon of biceps brachii muscle, and the last one is radial nerve. So the marked structure is this in the question given below, that is radial nerve. But let us see the labeling of all other structures. This one is basilic vein, this one is biceps brachii muscle, this one is median nerve, this one is median vein, pronator teres muscle, this one is brachioradialis muscle, this is brachialis, and this one is cephalic vein. So this marked structure is radial nerve. The action of radial nerve is extension at wrist joint, and the action, if gone, that will lead to wrist drop. So the answer is D, wrist drop. Now move on to the next question. Which of the following structures given below is related to the structure highlighted red in the image? This labeled structure is ischial spine, and the structure related with ischial spine is pudendal nerve. So the answer is A. The next question is, all of the following form the marked structure except. So the structure marked is actually the dorsal digital expansion of middle finger. Second dorsal interossei, lumbricals, and extensor digitorum. These three muscle forms the dorsal digital expansion of the middle finger, but second palmar interossei cannot contribute to that formation. So the answer here is D, second palmar interossei. Which of the following structures of the brachial plexus do not give any kind of branches? So this is very simple and basic question. Roots give branches, cord give branches, trunks also give branches, but division cannot give branches in the brachial plexus. So the answer is D. Now the next question is the lesion of the structure marked as A causes. A is median now because we have recently discussed this figure of cubital fossa. The lesion of median nerve causes the loss of sensation of the nail of the index finger because these three things, hypothenar muscle wasting is not seen due to median nerve because median nerve supplies thinner muscle, not the hypothenar. Loss of sensation at the tip of radial tubercle, this is also wrong, and loss of sensation of the fourth interdigital cleft, this one is also wrong statement. So the answer is A. Loss of sensation of the nail of index finger. Which of the following related to the marked area in the image? This is the topmost part of the left kidney, which is related with stomach. It is not related with spleen. It is not related with second part of duodenum because right kidney is related with second part of duodenum. This is not related with pancreas also. So the answer here is stomach because stomach is directly related with superior part of left kidney. The posterior part of stomach is directly related. The blood supply to the structure marked in the image is by the structure marked is fornix, blood supplies, anterior, cerebral, artery. So this is the blood supply of fornix, anterior cerebral artery. The answer is C. The next question is marked structure is derived from the. This is the membranous part of interventricular septum, which is derived from endocardial cushions. The next question is all of the following supply the marked structure except. This is a right atrium, which is marked in the figure. It is supplied by right coronary artery. It is supplied by anterior interventricular artery. It is also supplied by marginal artery. But it does not supply by diagonal artery because diagonal artery is the branch of anterior interventricular artery and which supplies left ventricle instead of right ventricle in 30 to 50 percentage of population because it is not present in all the humans. It is mostly present in 30 to 50 percentage of the population of the humans and it arises from the anterior interventricular artery. It does not supply right ventricle and the right ventricle is the structure marked in the image. Next question is what is the nerve supply of the structure marked in the image below? So let us label this whole figure. This one is superior oblique. This one is levator palpebrae superioris. This one is superior rectus, lateral rectus, medial rectus, inferior oblique. This one is facial sheath of eyeball and this one is lacrimal gland. So the marked structure is superior oblique and superior oblique we have remembered the mnemonic that SO4 and superior oblique is supplied by the fourth cranial nerve that is the trochlear nerve. So with this we conclude the our third session of anatomic recall questions of AIIMS 2019 examination. So in this session we have came to know that AIIMS is very keen to ask different dissection figures. So we have to familiar with this kind of dissection figure, and we have to see the way that examiner asking this kind of figures, because it is very important to know that we have to master all the dissecting gross anatomical pictures to know this kind of question, and to answer that question easily and effectively. So with this, we complete our session. Thank you so much for watching. See you in the next one.